Well, my name is Lisa Martin. I work at Putnam Pediatrics and Internal Medicine. Have been working there for many years, almost 20 now. Take care of adult primary care and children's primary care, basically from birth until elderly age. Well, the flu shot has been very important, and I think everybody should get it from age 6 months and older. It helps to protect you from significant influenza disease that can wind up in the hospital, on a ventilator, in the ICU. Sometimes it's very effective, and if you do happen to get the flu after you've had the flu shot, the disease is much more moderate and much better in terms of your survivability and your illness in relation to it.
I'm Keith Landry. I'm a family medicine doctor practicing here in Cloverdale, Indiana, and employed through Putnam County Hospital. We know that every year that the influenza virus is going to have a huge impact on health. Nothing's more important than hand washing and not touching your face. In general, we know that people that do get vaccinated have a lower risk of developing a serious influenza outbreak.
Well, for this year, we're looking at going into a flu season that not only has influenza as a potential illness maker, but also COVID-19. With that is that we're not sure what it'll look like if you happen to get both viral infections at the same time, but certainly your risk of having a terrible illness or being in the ICU or being admitted to the hospital is much higher should that happen to you.
Yeah, we're planning on this being a very confusing viral season for medical professionals like myself. Someone's going to come in with, fever and cough and upper respiratory symptoms. It's going to be more difficult for us to determine what the cause of that is, whether it's influenza or potentially a coronavirus or some other virus that's within the community. We hope that more people will get the influenza vaccine this year. We hope that more people will wear masks and stay home if they're ill, and then of course wash their hands and try not to touch their face.
But anything that we can do to try to prevent the overwhelming admissions that can happen not only with flu and COVID in the same season would be a wonderful thing to do. So to get your flu shot and have either no flu illness or a milder flu illness would certainly decrease the hospital utilization, the ventilator utilization, the ICU utilization in light of us still coping and dealing with this COVID-19 pandemic.